Welcome, everyone. We are connecting again for the next panel discussion. As I already teased before this short break, this will be about upskilling, reskilling, and the society and healthcare professionals to make sure that we can embrace fully the benefits of the digital transformation. The title of this session is the Health, Home, and the Workplace. How do we develop the skill set needed to benefit from the digital transformation? Your moderator for the session is my colleague Natalia Allegretti, Senior International Project Manager at the ECH Alliance, and she's joined by four distinguished speakers representing the European networks, different levels of governance, and also different initiatives that focus on developing the health and well-being solutions for different groups of the society and also the healthcare professionals. We're in the interesting time we're living interesting times, and we have now the new policy and framework in the EU called Next Generation EU, which is where a lot of effort and a lot of funding and investment will be made, will be channeled towards the upskilling and reskilling. And here with our speakers, we would like to explore what should be done. So without further ado, I pass the virtual microphone to Natalia. Please, the floor is yours.
Thank you very much, Carolina, and good morning to everyone. I'm very pleased to be here today and to have the chance to have such a beautiful panelists around me and dear colleagues also. So we are going to discuss how much a set of skills is going to be needed to really fully benefit from the digital transformation that is impacting our global society. Let me introduce my panelists today to the audience. So we have Laura Candy, Policy and Project Consultant at the European Health Management Association, Haris Vassiliou, Digital Transformation Advisor at the Hellenic Ministry of Digital Governance, Harriet Hansen, EU Consultant and Project Manager at the South Denmark European Office, and Trine Angerman, Head of Innovation and Digital Training at the University Hospital of Southern Denmark. During our conversation, our kind colleagues are going to put in the chat relevant links that you have shared with me. And as I said, I would like more to have a conversation with you rather than a presentation, let's say, towards the audience. And for such a reason, I would like to start our little chat with a statement made 5 years ago, that now seems an age ago, from one of the most prominent futurists in the world, Gerd Leonhard, who stated, humanity will change more in the next 20 years than it did in the previous 300 years. And for sure, the COVID-19 pandemic has made this statement more true, so that in the space of just few months, the implementation of digital health technologies, but not only, has assisted an exceptional speeding up. The speed of technology change has accelerated so much that, in my opinion, and in the opinion of most of the population, has created a significant gap between its race and the human adaptability capacity. How to fill this gap and how much skills are relevant in this framework? I would like to have your views at different levels, and I would like to start with Laura with a European, let's say, overview. We know that the European Commission is working hardly to fill and to tackle the digital skill gap, and even the recovery plan for Europe proposed by the Commission in 2020 is focusing on skill-related activities. Public and private organizations all over Europe, but all over the world, I would say, are joining forces to take concrete actions in this framework. And your organization is playing an active and key role in some of these initiatives. Will you be so kind to share with us your experience and knowledge in relation to these ongoing policies and initiatives.
Thank you very much, Natalia, for this introduction and for the question. And of course, thanks to the Digital Health Society and ECH Alliance for the invitation to join this panel. So skilling of citizens and of the health workforce has been identified as a priority by the Commission to ensure that Europe takes on the opportunities of the green and digital transformations. And of course, as you mentioned, Natalia, and also Carolina earlier, is that this is reflected in adoptions of plans, such as the European Skills Agenda already in 2016 and right now. Or the increased investments in workforce training and upskilling through various funding programs. So whether we're directly looking at digital and green skills or skills that are needed to meet needs related to specific diseases, such as cancer care as an example, whereas in 2020, there have been many funding calls relating to that. So during the pandemic, of course, the health systems had to heavily rely on their core resource, which is the workforce. And like you mentioned, all those leaps also that have been taken in adopting digital technology to deliver services has also exacerbated the need for health professionals to be better prepared and of course, better supported to face emerging challenges and adopt innovative solutions. So EMA, the European Health Management Association, actually co-leads with Health First Europe, a stakeholder network on profiling and training the healthcare workers of the future. And this is a network within the health policy platform of DG Santé with over 200 members. And the stakeholder network had developed different sets of policy recommendations on the health workforce training in 2020. And in February 2021, we presented those at the Pact for Skills Roundtable on the health ecosystem, which was hosted by the Commissioners Schmidt, Breton, and Kyriakides. So one big flagship activity that's been talked about lately within the training of the health workforce in digital skills and green skills has been the Pact for Skills, which celebrated its 1-year anniversary this month. So the Pact for Skills, as you know, calls for the development of sustainable cooperation and large-scale European partnerships. And those, when we look back at many things at the previous level, they were really national level initiatives, regional level initiatives. So right now, there's really a focus on having more European partnerships and to have concrete actions on upskilling and reskilling. And 5 partnerships already exist in different industrial ecosystems, and although different health stakeholders have committed to join the Pact for Skills, for example, the health ecosystem hasn't yet to develop a partnership on that level. So there is here an opportunity for the health workforce and different health stakeholders to actually continue to collaborate to form a European skills partnership. So I'll stop here for now and hope to continue the conversation a little bit.
Thanks a lot, Laura. And also we have been working together on the Pact for Skills and now on the follow-up. So I really hope to see how much these policy recommendations have been put in place in the next future, and how much of these recommendations have been taken into account by the Commission in relation to the programs and activities and strategies that have been implemented so far. I forgot to ask to the audience that if you have questions, please put them in the chat box. I will be pleased to share them with my audience. I see that we don't have questions so far, so maybe we can give the floor to Harris. We have been talking about the European level right now, but also we know that at national level, a lot of programs and implementation are ongoing on. And given your role within the ministry, I'm sure that you are closely seeking at national level what the government is doing to support the development of appropriate skills for all the society, I would say, so not to leave anyone behind. which are the main key intervention pillars and which are the main obstacles, in your opinion, at policy level that can hamper effective achievements in this area, in the area of digital literacy?
Well, thank you, Natalia, for this question and for having me here among this esteemed panel of colleagues. Great question. I mean, in Europe now we've been talking really constantly about capacity building is a key element for building up our societies. And the Commission, during the last strategies that it has announced, it's focusing primarily on this main pillar. So we can see that in the 2030 Digital Compass, has been described explicitly, having specific KPIs on digital skills. We've seen that on the Digital Education Action Plan until 2027. And in the Digital Europe program, which has been recently announced, having a specific strategic objective on digital skills. So it has been an element which is really pushed by the Commission, and rightfully so. And of course, as Carolina mentioned, is a part of the Next Generation EU as well. So in the Hellenic Ministry, we have closely listened, monitoring this change in strategy and try to apply it also on our strategy at a national level, leading to a series of interventions, starting from the Greek digital transformation strategy, which has been defined for the first time in Greece until 2025, which is a thoroughly described strategy with specific goals and visions and priorities. We have key intervention pillars and more than 400 projects on digital transformation until the year 2025. And digital skills is one of these crucial elements that we have in the strategy. And focusing on enhancing the teaching of innovation technologies in all education levels, from secondary level to universities, improving students' digital abilities, while at the same time creating the Digital Academy for Citizens, as we call it, which it basically ensures that people of all ages will be able to acquire the needed skills through live or online programs whenever needed. I mean, a crucial factor that we've seen during the COVID pandemic was the fact that here in the ministry, we have started to develop a series of governmental services provided, especially during the lockdown. And people, especially people, older people, were not able to use these services. They were constantly around the traditional ways of visiting a governmental desk, a public service, to get what they wanted. So that led us to build this National Digital Academy, which is an initiative of the ministry, which is basically enable free access to all Greek citizens to high quality of digital education services in order to help them get online educational material, free and accessible to all. And of course, we are running the Greek National Coalition for Digital Skills and Jobs, which is a cooperation platform between various entities, either public or private, involved in promoting and enhancing the digital skills locally in our society. But most importantly, I think is the fact of what you mentioned, the fact that we need digital skills in diverse domains of the economy. And for that reason, healthcare is one of the critical areas that we want to place our strategy for the next few years. For that reason, we have created a subset of our strategy in order to try and create the National Digital Health and Care Workforce Education Roadmap for digital skills, trying to focus on the healthcare professionals, which is basically reviewing what's the current situation, define a clear strategy and action plan, launching a centralized board, a task force for promoting digital skills in this area, and performing some pilot actions towards this end. We also, as in my capacity coordinator of the Smart Work project, have been able to learn or get some lessons learned from the healthcare area specifically, because we have developed specific services such as the Work Coach, which provides demand training support, personalized training support to older workers. So this experience has really helped us also build up on this national strategy.
Thank you very much, Haris. And yes, we are touching one of the most sensitive, in my opinion, issue, which is taking fully into account all those people that at higher rates of risks of exclusion. So we are talking about the elderly, first of all, and we will talk with Henriette about people with special needs, and with Trine, we are going to talk about patients that have not been taken so much into account so far. If you don't mind, I've got a question for Laura before we going on, and also one for you, Haris. So let me start with Laura. Okay. How can health systems effectively support the training and upskilling of the healthcare workforce to drive digital transformation?
Thanks, Natalia. So this question has been one that at Emma, we've been really working with different stakeholders at different levels to attempt at answering as health management and policy and professionals are working together, how do we make that happen? So one of the first things that we're seeing is that there exists a lot of best practices out here that are already implemented, whether it be at the organizational level or like Haris was mentioning how Greece and of course different countries are already implementing things at the different their own levels. So what we've been trying to do really is ensuring that it's not, the wheel is not new. Don't have to necessarily invent new things. So a lot of those skills that are needed are already being at different level implemented. So it's really going towards the goal of finding and identifying those best practices and seeing how can they be implemented, scaled up on, or implemented at different levels. So something that works, of course, in one country may not work on the other one. How do we do that translation of evidence and ensure that lessons learned from one country, from one organization can be transferred? So really focusing on that exchange of best practices and of course implementing them and scaling up from them is one area that as we really are focusing on, at least at the European Health Management Association level.
Thanks a lot, Laura, for your in-depth view in this relation. Haris, I see that the audience is pretty much interested in the key obstacles for applying strategies for digital transformation of public healthcare services. Can you give us your view on this, basing on your experience, and maybe touch base a little bit on the risk of inequalities if these key obstacles are not overcome? Thank you.
Of course, Natalia. Yeah, that's a very, very interesting question. I mean, as you mentioned, the fact of special communities in our society obviously have different requirements behind the whole upskilling and reskilling process. So during implementing these strategies, I think we are looking at mostly, four key obstacles. The first one, which is a really critical one, is the diversity that we have in the society in terms of skills, the current ability that people have, the different educational culture that exists in the society, because we see different educational culture now for obviously different ages and different regions of the country. And obviously the age element is quite a critical one. As you mentioned before, we see differences in younger people, which are more proficient and more digital literate than older people. And of course, a key aspect is also the domain of the economy. I mean, the domain that we want to focus on, the digital skills. It's a difference if we're looking at general digital skill development or development of skills in the healthcare section, or as other initiatives that we're looking at right now, such as the blue economy, coastal tourism, and so on. So these are very key elements in terms of obstacles. You have to take into consideration in the strategy, in the design, all these different elements. Another problem is the availability of different resources and educational content that we have. Locally, the content needs to be translated in the different languages or created in our local language. There is usually a narrow, path that we have when content is created. People are usually focusing on specific domains, and you tend to have sometimes repetitive content of similar items. So you don't gather a broader pool of resources available for the different diverse needs that you have. That leads to increased cost, which needs to be covered at somehow. And of course, we have another issue, which is at the governmental level. The continuous changing of policy sometimes when new governments come, or you have different people in different key locations of the government that affect the change of the policy and the refocusing of the digital skills agenda. So I think these are critical factors taking into consideration. The first one, which is talking also about societal diversity and taking into consideration the different people, personalities and capabilities.
Thank you very much, Aris. And I would say that this is one issue that we have dealt with a lot with Ariette in one of our collaboration, talking about content, talking about people with special needs, risks of exclusion, and how much the involvement of the final user, of the final person that has really to use this content produced, is so important since the very beginning of the process. So, Ariette, I leave the floor to you, just saying that the region of Southern Denmark and Denmark in general is really a front runner when it comes to digitalization, but also it has a solid tradition of openness, dialogue, and citizen involvement. How much do you think that how much people with special needs or higher risks of exclusion can be deeply involved and can also enjoy from the transformational benefits that innovation in science and technology can bring to the society as a whole?
Well, I think that they can be involved a lot from the very beginning, and I've made a very short presentation. I'll try to share it with you. So, can you see it? Okay. So maybe I should just, like that. So I'll try to do this, because you talked about, Natalia, in the beginning that we can see a lot of changes right now, but I actually think that the changes already started in 2008 when we had the financial crisis. I have been so much involved in European projects since the late 19th, and really and always in the welfare sector. And we really saw in 2008, after the financial crisis, that we had to think in new ways. And at that period, I think that it was really acknowledged that we had to think in new ways, including the final users much more, working much more with telemedicine, and thinking much more with empowerment and so on, in order to ensure the sustainability within the welfare sector, and also to make sure that we had a high quality in cure and care. In Denmark at that moment, we started talking about what we called the welfare climb, meaning that how do we ensure high quality within our welfare sector at a time where we actually have less money. So we had to do something about that. And for example, in the southern Denmark, at that moment, we created this South Denmark Health Innovation Center, where we started really to work a lot with user-driven innovation, and we created a big like factory that we call Plug and Play, where we involve the end users from the very beginning. And for many years, the region of Southern Denmark, you know it very well, we have been involved in European projects. We have been involved in the IBON AHA. We are reference sites. And one of the reasons why we have been appointed a reference site is also that we are working so much with the end users, with all these initiatives that we have in the region, for example, Plug and Play and so on. And one of the projects that we have had, for example, in the region of Southern Denmark, is the Eden project, where we are partners together, Natalia. It's a very nice project. It's focusing on, and Eden stands for Embracing Dementia. So in that project, we are focusing on people living with dementia, and especially also the relatives, because some years ago, actually in a HCHA Alliance conference, I was listening to a presentation from a relative, and she talked about all the difficulties, all the confusion that she had when her father or mother, I don't remember, but her relative was diagnosed with dementia, and she was almost left alone with all this big responsibility. And when I heard her speech, I was thinking, we can make a European project out of that. And it was really something that was interesting, and it has been interesting in this project that we have been running for 3 years. And we have made a platform which is especially designated for relatives. I'm sorry. You know, Natalia, that I've been sick for almost 2 weeks now, so I'm sorry that my voice is getting
Take your time.
away again.
Take your time. Yes.
So we have developed this very I'd say elaborated platform with a lot of information that can be used both by the relatives but also people living with dementia. And then a very interesting concept that we have also developed in the Eden project is this community collaboration concept, which is based on design methods, a method that has been developed by the British Design Council called the Double Diamond. You can see it there in the bottom, in the corner. And this concept is developed to really engage all stakeholders when you want to work and create good living conditions for people living with dementia and their relatives, and the collaboration that you can have with many stakeholders on local level. Among these also health professionals and volunteers and civil society organizations. But coming back to competence development that you said in the beginning, because involving the stakeholders and involving the end users, it's not just something that you do like that. I think that you need competences to do this. And as we have seen now in many projects from the region of Southern Denmark, either with user-driven innovation or co-creation, the health professional need some competences to kickstart, to run, to engage stakeholders, to recruit stakeholders, to maintain the interest from the stakeholders, and also to communicate about all these co-creation processes. And for that, we have also created in the region of Southern Denmark a project which is called Co-Creating Welfare, which has developed training courses, especially for professional practitioners in the welfare sector, if they want to kickstart and run these co-creation processes. So this training material is gathering different kinds of of design methods, of co-creating methods, where the health professional can actually learn how to involve the stakeholders and the end users in specific co-creation processes, specifically in the welfare sector. And I think that's really something which is very important if you want to successfully involve the end users in these kind of co-creation processes, which can be win-win situations if you do it in a good way.
Yes, thank you very much, Henriette. And I think you're very right, and you have raised interest in our audience. So, yeah, you have been talking about the Eden Project. We know that the Eden Project aims to really embrace dementia as not as a single problem, but as a community problem. So one attendee was asking while you were speaking, I'm not hearing about what we do to help family carers in building skills they need. We expect them to do so much and yet never think to train them. Have the panel got good practices, examples in this relation?
Well, we have not worked specifically on training relatives, but this platform that we have developed in the Eden Project is gathering really a huge range of different knowledge, science results, good practices and everything, which can help the relatives to know a bit more about what they can expect from the disease, how it will develop, how they can expect from their loved ones, how they will change, how their situation as a relative can change, and good practices about how to be a relative, good practices about how to communicate with the health professionals and so on. So you can say it's not concretely training, like a training program, but it's a lot of information material which can help the relatives and also the people living with dementia in knowing what to expect from the development of the disease, and how the relations will also change, and how they can maybe anticipate the changes that will come, so that they are better prepared to what they will meet in the future. And it will also help them, for example, to ask qualified questions toward the health professionals, what to request, what to demand, both in relation to technological solutions, but also to financial support or support, physical support from the health professionals.
Thank you very much, Henriette. Yeah, and I also think that there isn't only, let's say, the formal training, but we can talk about also informal training, which might have the shape of an open dialogue. And
yes.
As you said, co-creation and co-design can really help in creating the right knowledge for the right person at the right time.
Yes.
But now let's listen to Trine, who is an expert in training in the field, in particular of health education and in the implementation and use of technology in healthcare. You are currently managing the Innovation and Digital Training Unit at the Hospital of Southern Denmark. And I know personally, because I was working with you, that during the first wave of the COVID-19 pandemic, you were on the forefront for providing on-the-job training to those healthcare professionals called to face an incredible and urgent, more than urgent situation. So as we know, also talking with Laura and Harris, that there are lots of activities and initiatives going on that are facing the challenge of preparing the healthcare workforce of the future. But to what extent the need of patients, the need of upskilling and reskilling the patient population has been addressed so far, and how much the patients are relevant in this equation. Thank you.
Yeah, thank you for your introduction, Natalia. I'm going to talk about the skills needed from a healthcare perspective, and I'm going to answer your question, but I'm not starting with answering your question. So I'm just sharing a slide here. Hope you can see it. Yes. So how do we develop the skill set needed for the digital transformation, both for the healthcare professionals and for the patients and their relatives? I'm going to talk about that. I'll start with the challenges that we face today in the healthcare sector. Technology is a powerful tool, but it has changed the way that the healthcare professionals work. It has changed their workflow and their workflow.
Trine, sorry if I interrupt you. Would you make the presentation in presentation mode? Because it's a little
small. I have made it in presentation mode. On my screen, it's on presentation mode.
All right. So, nevertheless, it doesn't matter. Please go ahead.
Yeah, okay. So it has changed the way the healthcare professionals work together and also how they work with patients. From a patient perspective, technology has provided access to healthcare in a new way or in new ways. It has provided them with different ways of communicating and working together with healthcare professionals. And for that, they need skills to not be left behind. So if we talk about the blue box here, what do we need to focus on? As I said, we need to focus on changing workflows for the healthcare professionals especially. And we also need to have focus on their behavior when they work with technology. I'll get back to that. But we work with behavioral design actually when we are trying to change workflows. So it's not enough having digital hands-on training. When we do the training, we also work with workflows. Another focus is that we need to create a culture of lifelong learning regarding digital skills. In healthcare, we always had a culture of lifelong learning with all the other skills we need to have present. But we haven't a culture of lifelong learning when we talk about digital skills, and that is the focus we need to have right now. Then we need to foster equal opportunities and equal access for all users of the healthcare system, and the technology can provide that, but not if the patients and their relatives do not have the skills for it. And last but not least, we need to build strong skills partnerships where we can learn from each other. And I'm going to talk about the DISH project in a moment, but actually in the DISH project, we are 6 different countries, and we have developed 3 concepts that are used in different ways in each country, but we can all use them. So we can all do digital training based on the concepts from the DISH project. Yes, and going to the red slot now, or the red box, I'm going to talk about the DISH project. DISH is a project that's called Digital and Innovation Skills Helix in Health. It's a project where we have developed 3 concepts that we are now going to test them, and we have been testing them in all countries, and they are working in all countries, but in different ways. The first concept is a learning innovation unit concept called the LEO concept. It's a kind of a questionnaire with a lot of questions in 8 different areas that we need to have focus on when we are planning the training, the digital training. So actually in Denmark, we have LEO meetings, learning innovation unit meetings, where we invite management, staff, doctors and nurses, IT specialists, and sometimes also the companies providing the technology. We sit around a table and and ask questions based on the Learning Innovation Unit questionnaire. And we don't ask all questions, we handpick questions. And by doing so, we are preparing together with the ward or the staff how we should plan the training. And the next concept on the job training concept is where we do the digital training. We can do that on the ward or in the simulation facilities. And we plan that, as I said, based on the LEO meetings. It's not only hands-on training in the concrete technology, but also we have to have a very big focus on the workflows because technology in healthcare changes workflows. And we won't reach our goal if we don't think workflows together with the training of the digital skills. The last concept is the assessment concept, and here we work with assessing the skills obtained during the training. So what is coming after this or next to this? There's different solutions we work with today. Based on the DISH concept, actually, I'm trying to start a new project in southern Denmark where we have patient schools, trying to establish patient schools for teaching digital skills to patients. And for that purpose, we use the DISH concepts. Then we also have different apps to secure equality and equal opportunities for all patients and relatives. This app I'll mention now is so that there will be no language barriers for patients and relatives who hasn't Danish as a native language. It's an app called Care to Translate. It has 39 different languages and is developed to be tested and used in the healthcare system. Then we have a lot of different video solutions that we have developed and try to test to give elderly living far away from the hospitals and others living far away from the hospital equal opportunities to use the healthcare system. Our hospital is in a rural district where we have a lot of elderly patients and we have a lot of transportation to the hospital. So therefore it's important that we give opportunities to also have conversations with the hospital through video solutions. We're also trying to have a new project where we use virtual reality in the training of both patients and healthcare professionals to learn digital skills. We have an app called My Hospital where it's a patient involvement app, but they need to go to a patient school or need to have digital training to use the full potential of the technology. So that's why we have a lot of focus right now on how we can use the DISH concepts to also do the skills training for the patient and the relatives. Yeah. Last but not least, we are also focusing a lot through technology and apps on medicine distribution to hinder failure in this area. Thank you. That was all from me.
Thank you. Thank you very much. Thank you very much, Trine. And yes, we have a question for you coming from the audience, which is focusing very much on the possibility to work with equality and equal opportunity. So how can we work taking into account the idea of equality and equal opportunity in healthcare, so in accessing also healthcare services when the patient's skills are different?
Yeah, as I said, it's a very large focus in my department right now because we know that introducing technology in healthcare has left a lot of patients and relatives behind because they do not have the skills. So actually the patient schools that we are establishing now based on the DISH concepts our initiative to try to reach out to the groups of patients that do not have the skills to handle the technology in healthcare, and thereby they cannot be involved in the same way as other patients. So I think when you have a operation or anything in the hospital today, often you go to a patient school to learn how to handle your disease or your illness after hospitalization. So that's the idea, that we would like to have a patient school that also handles the digital skills, just like we do if you have a special operation or whatever. So it's the same kind of patient school, just focusing on technological skills or digital skills. Yes, I don't know if I answered your question. No.
Yeah, I hope the audience is happy with your answer, but the answer is yes from my side. So I think that it's a common opinion from all of you that the possibility to upskilling or reskilling the population overall is a key asset to assure equal opportunities and the possibility to really have an equal possibility to access to basic, let's say, or necessary services like healthcare services are. Is this true? And how much, in your opinion, a concept and a culture of lifelong learning is really relevant towards equal opportunities in society? Laura, can I start with you?
Yes, absolutely. So I think it's as true in both Hattie's and pretty much Harriet as well has mentioned. When we're looking at skills and what already exists, we have, of course, those general skills that are needed in lifelong learning. There are many initiatives already on those points, and that are being pushed, of course, to ensure social fairness and equality and address inequity. And now looking at when we look directly at the health workforce and how having lifelong learning in those general skills also impact their day-to-day activity in the workplace, and ensuring that not only those exist for the general skills, but also for the digital skills that are needed, and those, whether it be digital skills that can be used across professions together, or digital skills that are quite specific. So one thing we've been looking at, and actually through the European Health Policy Platform, one of the recommendations that we had is to really create more opportunities for lifelong learning, including interprofessional learning programs, looking at competencies that are not just that are necessary for digital transformation, but not just about digital skills. So things such as skills for partnerships, communication skills for adopting those are skills that normally in lifelong learning programs that are being developed. So all of those are important indeed, in not just daily in ensuring social equality, but of course in to support and facilitate the work of the workforce. So
thank you. Haris, apart from the healthcare workforce, because I think that Laura's approach can be also related to other workers, for example, how much is important upskilling and reskilling to really join an active role in society, for example, and really embrace the digital transformation?
Well, I mean, yeah, absolutely. I mean, crucially important. And following on Laura's comment, I think it is indeed, as I mentioned also in the beginning, one of the core elements, to evolve society, to make capacity building a reality, and to help all the different all different society members to equally access and have equal opportunities, either job related or health related, or basic everyday living from now on, become digital citizenship, as we call it, as well. It's quite important, but for me the main concern is have a strategy and have a plan with a continuity for taking into consideration all these people and their specific needs that its group has. So now we are trying to build a pilot program here in Greece for providing increasing digital literacy for older people by having initiatives such as helping older people at their house or at local older community areas, or even reaching remote areas. We have certain villages or certain areas remote here, for instance, in Greece, that they don't have access to anything like that at all. So we need to reach them. So for me, it's really important. If you need to have a transformed society, a transformed digital society, you need to access all domains of the economy, take specific considerations in all the different requirements of these people, and build content, build resources, educational resources, which is really, really important.
Thank you, Harris. I completely agree with you, and yes, let's say that the motto should be let's try to not leave anyone behind in the development of this modern society. Harriet, which can be the calls for action on this line?
Well, I definitely think, as Trine also said, that that providing training to the citizens and also to the end users are really important as well. And it actually also what Harry said, reaching all those people who are also in the rural areas, and I'm actually right in the middle of developing a new project, which is focusing on that, on an Erasmus project, on how you can actually bridge. So very often we saw that during the COVID crisis in Denmark, that very often the local authorities, they were ready with all the digital solutions, all the digital services and so on, to reach the citizens, but especially the citizens in the rural areas. It was not possible to reach them. So I think we really need to do something there, and need to find a way on how to make a bridge between the local authorities or the regional authorities, depending on which country you're talking about, and the citizens, and especially those living in rural areas. And we are thinking about creating some kind of welfare ambassador who can actually make that liaison between the local authorities and then helping people living in the rural areas who are not so experienced with digital solutions, who do maybe not have them yet. So how can we create this liaison with a kind of welfare ambassador that can help peers in rural areas actually to be more connected and learn to use these solutions? So it could be an invitation to you, Harris, to do a project together.
We're thinking of we're already in place of an idea regarding mobile digital units, so maybe we can combine the two ideas.
Yes, we could.
It would be very interesting.
Yes, it would.
And yes, Trine, please. We just have 2 minutes, 3 minutes to finish, but you're muted, Trine.
Yeah, Natalia, when you introduced me, you said that I had been working with all this during COVID, and that's correct. one of the things we learned was that a lot of healthcare professionals actually can use the video solutions when they need to. So that's why I'm always saying now, it's not only about the hands-on training, it's also about culture and workflows. So as we say at our hospital, culture eats strategy for lunch, and that's actually has been shown during COVID-19 that they can often use the digital solutions, but they won't if they have other options.
Yes, exactly. And we will have another session, maybe sooner or later, talking about skepticism in using digital technologies and how we really can push towards a more open-minded society in embracing this solution, not in an emergency situation as we have assisted in the last years. So, dear panelists, it has been really a pleasure to have this chat with you this morning. Thank you very much for all your support and insights. And I leave the floor back to my colleagues and see you soon.
Thank you for inviting us, Natalia.
Thank you very much.
Thank you, Natalia, and thank you, distinguished speakers. Thank you, all panelists. It was fantastic to hear from you about the needs and then how we can actually address them on different levels of governance. And with this, I would like to, we are connecting the dots between innovation, knowledge, and our communities one by one during those 2 days. We are halfway in the day 2, so with this, I would like to invite our panelists and our participants to the lunch break, 1 hour lunch break until 2 o'clock Central European Time, 3 o'clock in Eastern European Time, and 1 o'clock in UK. Not easy with the time zones during the virtual events, but I hope you will find us back in 1 hour and you will tune in to listen to my colleagues. Andy Bleeden will connect the dots in the EU presidencies through the ECH Alliance Community of Ecosystems. We still have 2 fireside chat, and we will launch the thematic innovation ecosystems on health data. So enjoy the break and come back in 1 hour. And thank you again.
Thank you very much.